Hello and welcome to another session at the Health Insurance Innovation Summit. Up next is Kim-Fredrik Schneider, founder and CEO of Abby, a global on-demand healthcare service which connects patients to doctors anywhere and anytime. He was previously executive vice president at Sermo, the world's #1 social network for doctors, and UK managing director for SSI, the leading provider of data solutions for market research. Kim has more than 15 years' experience in the healthcare and business information sectors and has spoken frequently at conferences and seminars. In this presentation, Kim covers the changing nature of healthcare, the challenges that need to be overcome to service a globally mobile, tech-savvy market, and how Abby is helping to bridge that gap. Please enjoy this session with Kim-Fredrik Schneider. Hi, Kim. Thanks for being here. Really looking forward to this session.
My pleasure. Thanks to everyone for joining us today. My name is Kim Schneider. I'm the CEO of Abby Global Health. So Abby is a telemedicine company which works with health insurers to give expatriates and travelers easy access to high-quality medical support from doctors in their home countries. Today we're going to explore two of the driving forces of our modern world. One is increasing mobility, and the other is improvements in healthcare. We'll look at the evolution of both and explore how cutting-edge technologies can radically transform healthcare delivery in the context of global mobility. So this is my great-grandfather, Anton Engelbert Sundberg. They don't make names like they used to. He was born in Sweden, the second child of his father's second wife. His father's first wife died in childbirth, and his mother's first child died as an infant. Despite that, he was actually born into one of the best healthcare systems in the world. In fact, one of the few that could be called a system. For example, he was one of the lucky few of that era to receive the only available vaccine for smallpox. Antibiotics had not yet been discovered, and anesthesia was at the cutting edge of medical care. At the age of 17, he ran away to sea, and he spent most of the next 20 years living in Asia, mostly in Japan, China, and India, where he eventually became captain of a 1,000-ton steamship. In the early 1900s, he was one of a tiny handful of Swedes living in Asia. How things have changed since then. With the discovery of antibiotics in 1928, the development of thousands of new drugs and treatments, a better understanding of infection, improved sanitation, the deployment of armies of medical professionals, all of this has caused maternal death and infant mortality rates to plummet globally. And today it's actually safer to give birth in Angola or Afghanistan than it was in Sweden 100 years ago. Meanwhile, 7% of Swedish citizens live abroad, including myself and much of my family. Each year, Swedes travel abroad 20 million times. That's 2 foreign trips per person per year. And a whopping 2% of the population of Sweden travels more than 8,000 kilometers to visit what my great-grandfather would have called the Kingdom of Siam, Thailand. This trend is by no means unique to Sweden. Globally, we took almost 1.2 billion international trips last year. That's twice as many as in 1995. Mobility is an unstoppable force with enormous implications for all aspects of life. International travel, which used to be the exclusive domain of the intrepid and the ultra-rich, has become common, and we take for granted that nearly every corner of the earth is easily accessible. When it comes to technology and travel, our expectations have also shifted enormously. When I was a boy, there was a full year's gap between a film being released in the US and it finally showing up in theaters in Sweden. I remember seeing Robin Hood, Prince of Thieves on VHS in the US, and half a year later going to the cinema opening of the same film in Sweden. Today, films and TV shows launch globally, and when they don't, millions of people download them anyways. For example, there are 54 million people using VPNs to access Netflix from the wrong country. So if we expect services of convenience and entertainment to travel with us, what about services of necessity like healthcare? In surveys, both expatriates and travelers name healthcare as a top worry. This leads many to treat healthcare the way people treat gas station restrooms. Even if they need to go, they'd rather wait till they're home. And they're right to be worried. In addition to the obvious barriers of language and culture and access, there are surprising inconsistencies both between and within healthcare systems, even among the world's wealthiest countries. So if we take a look at a couple of examples, OECD data shows that hospital admission rates are twice as high in Germany compared to Canada. and you're 4 times more likely to have knee replacement surgery in Finland than you are in Israel. So how do we address the challenges of healthcare in the context of global mobility? At about 10% of the world's GDP, the global healthcare sector is massive, and the reasons for inconsistencies and discrepancies are varied and complex. Rather than trying to solve the whole puzzle at once, at Abbey, we've decided to simply start at the beginning. We've decided to focus on the first mile of healthcare: preventative care and well-being, health information and support, chronic disease management, simple diagnostics, and common prescriptions. This is where we can touch the most people and where we can reduce costs further down the line. For example, by improving access to care, we can increase early detection for serious conditions. It's estimated that 70% of in-person doctor's visits could be taking place virtually. With pressures growing on the capacity of healthcare systems globally, major players from the UK's National Health Service to the government of China are investing in remote medical services or telemedicine to improve healthcare delivery, reduce costs, and relieve those pressures. One of the reasons telemedicine can have such a dramatic impact is that the first mile of healthcare, the ambulatory care setting, is also where there has been the least amount of progress over the last century. Technological innovation is everywhere in modern healthcare systems, but we still expect people to enter those systems through doors designed and built centuries ago. At Abbey, we challenge ourselves to develop a first-mile healthcare solution, which is, first of all, truly global, so that patients anywhere in the world can access physicians anywhere in the world. Second, one which improves the quality of care, particularly in terms of consistency and best practice. And finally, we wanted to develop a service which is radically convenient, which removes virtually all practical barriers to accessing healthcare. In many ways, the first challenge to build a truly global solution is the most difficult. There are, of course, regulatory challenges, but none are insurmountable. The greatest difficulty is actually practical. As a rule, companies providing remote healthcare services have struggled to engage significant numbers of physicians because building and maintaining these relationships is expensive. The vast majority of telemedicine companies operate in a single country, and a handful are regional, but none have been able to create a global solution until now. By integrating with existing, well-established physician networks, we are able to reach more than 1 million doctors practicing medicine in 50 countries, representing dozens of specialties and subspecialties. With this unprecedented coverage, we make it possible for expatriates and travelers to immediately connect with physicians in their home country, in their host country, or anywhere else in the world. These are truly doctors without borders. So what about the next challenge, improving quality? With 30,000 known diseases and nearly 15,000 drugs on the market, the scope of modern medicine is really beyond the capacity of any one person. It's no wonder doctors don't always get things right. In fact, according to the World Health Organization, 23% of Europeans have been directly affected by medical error. And in the US, these errors generate more than $20 billion in additional medical costs each year. But that human tendency for error is intimately tied to the human capacity for creativity, for discovery, and for problem solving. In the case of medical error, the clever application of simple technologies can have a profound impact. For example, in 2001, Dr. Peter Pronovist implemented a simple 5-point checklist for a single procedure performed during surgeries at Johns Hopkins University Hospital. In this single experiment, he and his colleagues avoided 43 infections, prevented 8 deaths, and saved $2 million. Powered by the book The Checklist Manifesto, written by Dr. Atul Gawande, the humble checklist is being implemented as a cutting-edge approach to reducing medical error in hospitals all over the world. If something as basic as a checklist can have a dramatic impact on reducing medical error, imagine the impact that artificial intelligence can have. At Abbey, we are developing AI-based solutions to drive consistency, efficiency, and quality of care. Our vision is not to replace doctors, but rather to reduce human error and amplify human intelligence. And the final challenge, radical convenience. We've taken as our guiding model the classic house call. As with a house call, rather than making patients come to us, our principle is to meet patients where they already are. We believe that asking patients to download a new app, sign up to a new service, figure out how a new interface works is too much of a barrier for people who are already caught up worrying about their health. At Abby, we've taken a radically new approach by making a virtual house call into existing apps which people are already using, where they're already at home. These apps are used by 97% of mobile phone owners. They're used multiple times a day by young and old, by rich and poor, by about 6 million people around the world. So what is this ubiquitous category of apps? Messaging services. From SMS to WhatsApp to WeChat to Facebook Messenger, messaging apps are simply the most popular mobile phone feature in the world. The world's largest technology companies have finally realized their potential, particularly when combined with artificial intelligence chatbots. Chatbots are able to understand and respond to natural language input from users. Some of them speak out loud, like Apple's Siri, the Alexa chatbot, and Amazon's Echo, but many operate via text messages. This is a cutting-edge area of technology. Some, like Microsoft's Satya Nadella, are predicting that chatbots are the new apps. And in fact, they're growing faster than apps did when they first appeared. In April 2016, Facebook announced that they would open their Messenger platform and its 1 billion users to third-party chatbot developers. Within 6 months, more than 30,000 chatbots had been developed for the Messenger app. But chatbots are certainly not the right answer in all cases. For applications which have a strong visual component like Instagram or Uber, a natural language interface is rarely appropriate. But for applications which are mostly text-based, like newspapers, present some powerful advantages, and some publishers like the New York Times have already launched chatbots. But the most powerful application of the natural language interface is when services are used infrequently but are still critically important to our lives. Healthcare clearly falls into that category. For telemedicine platforms which rely on app downloads and website signups, utilization rates are well below 5%. This poor utilization significantly dilutes the otherwise impressive cost savings of telemedicine and prevents these services from living up to their potential. By using a natural language interface and embedding our service into messaging applications which people are already using, we're driving higher rates of utilization and increasing the benefits for our patients and our health insurance clients. For our users, Abby exists as a contact in their address book, another friend in their messaging app. We've made getting professional medical support, no matter where you are in the world, as easy as asking a friend for advice. Thank you.
Thanks, Kim. Lots of very interesting insights there. I have a few questions to follow up. Sure. Let's start in general about Abby, and then we can talk about industry-wide and some of the trends that are happening. So where is Abby based, and what are the regions that you're targeting specifically? I know you guys are a truly global platform, but are there specific regions that you're targeting?
So we're headquartered in Ireland, and we have an office in Spain as well. The team is from all over the place. And we are launching as a global service. That's our intention, to be global from day one. It's really from anywhere to anywhere. There are some countries that are not yet covered, but most of the major destinations for expatriates and travelers around the world, as well as the countries that they come from, are covered by our service.
Okay. And in terms of the challenges that you're currently facing, you mentioned regulation is obviously a big challenge, but not the biggest challenge. But what are some of the regulatory challenges that you are facing, given that you're going to be launching as a global service?
Well, the biggest issue is actually that in many markets there's a lack of regulation. So there's a lack of clarity in some cases about where telemedicine services fall. But in general, outside of the United States, the principle is that telemedicine services are practiced in the location of the physician. So that means that for expatriates and travelers in particular who are reaching out to doctors in their home country, it's really no problem for them to be using these services. It gets a bit more tricky in the U.S., and that's something that we're working with our lawyers to figure out. But again, it's not insurmountable. It just gets a little bit more complicated because of the way the U.S. Views telemedicine at the moment.
Okay, and a big, telemedicine's been around for a short while now, but a big challenge that a lot of these services seem to come across is engagement. Right? There's very often there's a low utilization. I've spoken to a few insurance companies that have these types of services in Europe and the US, and they're coming back with very little usage from their users. So how is Abby different in that sense? How are you guys going to be approaching that challenge?
Yeah, I mean, I think we see that as one of the biggest weaknesses of the model. It's really clear that when it is used, there are enormous financial benefits for whoever's paying for the service, and there are enormous service benefits for the user. But yeah, utilization is definitely an issue. Our approach of using this natural language interface and integrating with existing chat systems, we feel like that's the best way to drive utilization. And there are a couple of reasons for that. One of the biggest reasons for low utilization is actually that people just aren't aware of the service, and the service is they're being informed about the service through a brochure or through an email newsletter or something that is not immediate. They maybe didn't pay attention to, and then when they have a medical question, they're being asked to again go to the app store, download something. So if they're not even aware of it, and if the process of getting into the service is really complicated and multi-step, if you've got a quick medical question, it's just not worth it. At some point, it's actually going to be easier to use traditional approaches. Whereas, again, in our model, by proactively informing people of the service in a medium that they're already using, already very familiar with, and letting them interact with the service in a way they're already used to interacting, we're seeing much higher utilization rates.
Yeah, that's interesting, and I think I can agree with that. Embedding yourself in a service that is already being used on a day-to-day basis by the user gives you a higher chance of usability. And so, looking ahead, you're about to launch. Your platform is in place, but what do you have planned for, let's say, in the next 5 to 10 years? You mentioned that you don't see AI as a replacement for doctors. For the time being, Abby is managing the conversation between the user and the doctor. Do you see any potential for your technology to actually assist in the diagnostic, or is that not something you're looking at?
No, it absolutely is. And I think that when it comes to things like artificial intelligence, there are a few things to say about that. I mean, one is that to some degree, artificial intelligence is any computer technology that we don't have yet. So it's always that fancy thing that's just around the corner. But in a more practical sense, artificial technology is no different from other technologies that we use, in the same way that computers have not replaced our jobs, or not all of our jobs. They've supplemented what we do, right? They make it easier for us to do the jobs that we do. We see AI as having a similar impact on medicine. There are always going to be things that physicians are better at, even 5 years from now, we believe. So there's definitely a role for AI to get involved in helping patients to ask their questions better. There's definitely a role for AI to get involved to some degree in things like basic recommendations or basic triage. But ultimately, we believe that that AI is there to assist the physician, not to replace the physician.
And how do you manage the quality assurance of the service that you're providing? So because the doctor is the one providing the service, but you're providing the platform between. So how do you keep a check on what's being said by the doctor to answer those questions? Who's managing that quality assurance perspective?
Yeah, so there's a well-established principle within the scientific world of peer review. So we're using a similar approach there, and having physicians review each other's answers, review each other's work, and then using technology to also monitor that and to track performance. And of course, patient feedback has an important role to play. Although there are areas where patients are not really able to evaluate physicians as well.
Okay, and taking a wider look now, more at the industry, and not not focusing on Abby, where do you see telemedicine heading? Obviously, you guys are at the forefront now, embedding AI into your services, but how do you see this particular space growing over the next few years?
I'm actually going to take your question and make it even broader, because I think there are interesting applications of this technology really in all areas of interaction between individuals and institutions. Again, messaging is something that we do with each other at the moment, very easily, very fluidly. It has enormous advantages. The fact that it's synchronous and asynchronous, the fact that you can include files when you send them back and forth. It's a very sort of light way of communicating. We see this as the right way to communicate, or one of the right ways to communicate. For insurance companies as well. I think there's an interesting conversation to be had there. As far as telemedicine is concerned, I think the future involves more ubiquity. I think it's going to be a completely obvious thing very soon, and more integration as well. The continuity of care is a really big deal, particularly for travelers and expatriates, which is our market. So finding ways to integrate with EHRs and to provide continuity of care, portable health records. These are the areas where we see things going.
Yeah, I think touching on a couple of points you just mentioned, continuity of care is definitely a big point. And aside from telemedicine, do you see the providers ever getting to that that stage where, as a globally mobile individual, wherever I go, what I want is to be able to receive the same quality of care wherever I go. So not necessarily just by telemedicine, but going to the hospitals, going to the clinics. So maybe obviously not on a global sense, but do you see the potential for, let's say, expatriate dominant regions to have that consistent level of care and sharing of information, so that, the expatriate that is globally mobile gets the same quality of care wherever they go?
Yeah, well, this is a really an area where artificial intelligence comes into its own, and I actually do see this as something that will be eventually developed globally. Right now, the reason care standards differ so much is just that it's too expensive to maintain standards, and I think that technology has some huge answers in those areas. So I think that particularly if you look at some of the differences in standards that we highlighted in this presentation between countries, there's just no good reason why they should have different standards of care. These are areas where understanding what best practice is. So, in the first place, looking at outcomes, long-term outcomes, and then making sure that physicians are applying best practice. This is really what I was talking about earlier in terms of integrating artificial intelligence and technology into the physician workplace.
Yeah, I have to agree with that, and I think that it's going to be very interesting to see how things develop over the next couple of years. I just have a couple of more questions to wrap up. What do you feel the consumer wants today? You touched on it a little bit in your presentation, but how far away are we between where we're at today and what the consumer is demanding today versus what the consumer is going to be demanding in the next 2 years? Because it's constantly changing. Are we going to be able to catch up to what the consumer demands are?
That's a great question. I mean, probably not. I mean, our expectations now, again, the expectations that we have of things like entertainment, as I was talking about, or just services in general. The expectations of convenience that we have would be seen as completely unreasonable just a few years ago. So I think that as technology delivers convenience, people expect even more convenience. It's there's one of the paradoxes of technology that as it arrives to make our lives easier, we just end up doing more work. This is true. This was as true of the washing machine as it is of the computer. So that's great. We become more productive. But I think that our expectations then start to get higher and higher as well. So yeah, we think that it's going to be a never-ending process of discovering what is the most convenient way to deliver a service. And we're not married to married to the bot app or to the natural language interface. We just see that as the right way to do things now. We expect services to be delivered more and more by voice, as you're seeing again with Amazon's Alexa and other services. But eventually, who knows? You'll be able to just you'll have so many monitors checking your health that a physician will call you before you even have a question, for example.
Last question. There's a lot of hype around AI. There's a lot of there are articles every day coming out about the potential for AI and the impact it's going to have across our lives. Are we maybe overstating this potential, or do you kind of agree with a lot of the hype that's been bandied around for the last few years?
Both. I think that then again, the same is true of the natural language interface. I think it's a question of application. And it's important to ask these big philosophical questions, and I think it's also important not to be alarmist about them. But some of the things that Elon Musk and others are talking about, those are important questions to ask and to look at. But where we are today is very, very far from those problems that they're talking about. The practical applications are very, very useful still. Very useful, but also very limited in some ways. There's a lot of work still to be done, even to get some relatively basic things in place. So I think that I think it's a combination of hype and reality, and I think the question in these cases is always to make sure that you have enough hype to keep things exciting, but not so much that you lose track of where you actually are.
That's a great place to end it. Thank you very much for that, Kim. Lots of great insights. I'm sure everyone's going to get a lot of value from that. And for everyone listening at home, if you want to find out more about Abby, Kim's contact details are on the slide. Kim, any last closing words before we close off?
Just thank you very much for putting this together. I think this is a fantastic initiative. I really appreciate the opportunity to speak to everyone today.
Great. Thanks to Kim, and for everyone watching, until next time.